Good afternoon, good evening, good day to each and every one of you. This is Dr. Amina Ali. I am coming to you today for the 2023 Mental Health Town Hall as offered by the Federation of International Gender and Human Rights. Today, we're going to be featuring Nigeria. Nigeria is going to be speaking to us about the do's, the don'ts, the ins, the outs, and the solutions that you need to start a program in your community. We're going to have a few questions being answered today, and we're going to be addressing some of the issues that are facing and affecting Nigeria. But these are going to be solutions that are going to be offered that you can use in your community right where you are. So sit back, relax, and enjoy the town hall today. Grab your great cup of tea and maybe grab a pen and paper so that you can start writing down some of the solutions that are going to be offered today. We have a great lineup for you. And one of the things that we look to is to welcome you all. So welcome embassy ambassadors, consul generals, high commissioners, diplomats, dignitaries, honored guests, supporters, and of course, local attendees. And today we have NYU here in New York, and we also have Fordham University that's going to be joining us. We have a group of students that are going to be coming to us from different perspectives. I think today is social work. One is what do we have? Social work, Fordham Law. Oh, wow. I like that. And of course, we have the mental health, psychiatry, psychology, and those that are going into case management that are going to be coming with us today. So I am going to be opening this session with the understanding that everyone is going to be a part of this and the voice is going to be heard around the world. So join us here today. We are going to have opening prayer. Actually, Queen Mother is not going to be with us today. So if we can, we do have another powerful prayer leader in Dr. Karen Lomax. If you can, Dr. Lomax, can you open us up in prayer today?
Yes. Good morning, good evening, good afternoon, where everyone is in the world. I knew she was going to pull me in, but thank you. And so, Father, we just thank you this morning for this gathering. We ask you to be with everyone who is in attendance. We ask you to be with those who couldn't be here. But Father, we're asking you to look down up on this meeting. Let everything go forward today. No interruptions, no disruptions. And Father, let everyone speak with clarity. Let everyone speak with confidence. Let everyone speak with boldness. And let all those who are in attendance have an ear to hear and a heart to receive what is being said. And so that we can take what we hear and take it back and be an assistance to your people. Now, as we go forward in this, we ask your spirit to be with us. And we give you praise, we give you honor, and we give you glory. And it's in Christ's name I pray. Amen.
Amen. Ameen. Allahu Ameen. Thank you so much. I really appreciate the givings of this event. I've had so many people from Nigeria contact me to want to be a part of this. Of course, we only have time for the 4, but they wanted to make sure that their voice was heard for those that are dealing with mental illness in Nigeria. And one of the things that touched me so much is that a few of the women came through and said, please, please, please make sure that we have the woman's voice representing mental health, because so many women are voiceless when it comes to getting served and serviced with mental health. So I wanted to thank those that gave me that little birdie in my ear to tell me to have women speak for women. So today you're going to be, as you see on the flyer, you're going to be welcomed by 3 women of the 4 that are going to be speaking today. And of course, I'm going to be bringing in issues of women and how it pertains in between. And as moderator, I'm going to keep the conversation light so that we can understand what it is that we are coming into this. We don't want to scare anyone off, but we do want to affect the change in the voice that is needing to be heard the most. So without further ado, we're going to be opening up today with a message from Queen Mother Catherine Hall Trujillo, who is our mother at the Federation of International Gender and Human Rights. She is someone that has been respected around the world, and today she has a message for you.
Hello, Fire Family, and welcome to our special event today to celebrate the wonderful world of women and the work that we're doing to co-create a better world. I'd like to give a special thank you to the United Nations for sponsoring this event and all the events that are occurring this month. And I'd like to give a special heartfelt thank you to our fearless leader, Dr. Amina Ali, who actually dreamed and brought into fruition the Federation of International Gender and Human Rights, which we all refer to as FIRE. And yes, we are on fire.
Yeah.
I'm here today just to remind you what great work you're doing at a time when the great work is so needed and called for. The idea of gender and human rights and equity is not just the frosting on
I can't hear anyone.
and to keep alive. So go right ahead and do what you're called to do, knowing that all is well. And when all is said and done, we are bringing a new world. We're carrying it. We're pregnant with possibilities, and it is being birthed as we speak. Thank you.
Thank you, Queen Mother. Did everyone hear that?
Not all of it, Excellency, just a bit.
Oh, wow. I'm so sorry. And that was a pre-recorded video, as you know, of Queen Mother. And it was very powerful, but I really needed to hear that today. So, wow, thank you. I'm so sorry that you all didn't hear all of it, but I'll check on that and maybe try to play it toward the end so you can hear her words. But for those that are coming on new, or those that haven't heard the story of FIRE, of course, we are a social impact organization that was designed and divined to be solutionists. We have readied ourselves to be an educator and an academician for gender and human rights. We set the stage and we've set the tone for education in this field, for the field of social dignity, and of course the adaptations of those that are survivors of sexual and gender-based violence, intimate and domestic partner violence, those that are dealing with the healing parts of FGM, child brides, those that are coming out of survivor sex, and human and sexual trafficking. And we deal with these entities every day so that we can make sure that there is a continuing offering of solutions for those that are going to be coming into this realm, and those that are needing the support in what it is that is necessary to get that healing. So today is not going to be any different. We're going to offer, again, solutions to gender and human rights as it pertains to mental health. So I'm glad that you're here. Thank you so very much for coming, and understand that our mission is simple. We are here to be of advocacy to you. If you or someone you know is dealing with a mental health crisis, please know that there is someone in your area that is willing to help. Today, we're going to set the tone in Nigeria to be the advantageous solutionist for mental health disparities. Our mission today is clear. We are going to offer solutions and you can repeat them right where you are. You don't need a title, a label, a degree, or any kind of professional advocacy to support someone going through a mental crisis. All you need to do is have empathy, compassion, and the respect of person to be that fellow. The purpose of this panel is to educate, inform, and to solicit solutions. So each of the panelists have questions that they're going to be asked, and these questions, in no particular order, will be cited for those things that are necessary and needed to start the ball rolling. You can get ideas from this, you can reach out to them and get further insight, or you can connect on social media. So for all of those that are coming aboard that weren't here in the beginning, I'm going to ask that you put your name, your email, and your site. If you have a business or site, please put it in the chat so that those that are able to connect afterwards, to include your LinkedIn chat, because everyone is connected on LinkedIn here, both at Fordham University and NYU. Speaking of that, for those that are on the live stream, Fordham and NYU, I'm going to ask that you start putting your questions in the live stream chat, and we're going to have the interns solicit them as they come through. If you have any questions that are immediate or urgent for a certain person, please put their name at the top of your question. So for example, if it's a question, let's say for Ambassador Densoho, please put for Ambassador such and such, put the name and then put the question, and I will read it just like that. So it won't be anything that is necessary and needed to question as far as who is to go to, okay? Please, please, please put your name, email, and just like Dr. Lomax put in there, put your name, what you do, your website, and your email so that they can be able to reach out to you. If you don't want to put that, put your name, what you do, and your LinkedIn, and let them connect from you there. Please, it's very, very important that we keep the professionals networked in with the students so that they can mentor and foster a new way to solutions. All right, our first speaker, as you know, is going to be none other than our own diplomatic speaker, Ambassador Dr. Andrew Ramjohn, who is Mission Ambassador to Trinidad and Tobago and the CARICOM. He's going to give opening remarks very, very quickly about mental health and aspects of mental health that you can take as gems today. Ambassador Ramjohn, if you could you unmute your mic? The floor is yours.
Thank you kindly, Excellency. I can't start my video for some reason, but anyway,
okay.
I would just like to take a moment to shed light on the important topic of mental health. I just want to say that mental health encompasses our emotional, psychological, and social well-being, and it influences how we think, feel, and act in our daily lives. It is an integral part of our overall well-being, just as crucial as physical health. Now, I want to just also say, mental health is not a fixed state. Rather, it exists on a spectrum ranging from optimal mental well-being to various challenges and conditions. Just like we can experience physical ailments, we can encounter mental health difficulties such as anxiety, depression, trauma, or substance abuse. It's important to remember that mental health issues can affect anyone, regardless of age, gender, or background. Recognizing the signs of mental health concerns is vital. These signs can manifest in various ways, such as changes in behavior, mood swings, difficulty concentrating, or withdrawal from social activities. If you or someone you know is experiencing persistent distress or impairment in daily functioning, seeking professional help is crucial. Thankfully, thankfully, there is a wide range of effective treatments and support available for mental health conditions. There are psychiatrists, psychologists, and other mental health professionals who can provide therapy, counseling, and if necessary, medication to alleviate symptoms and promote recovery. Additionally, self-care practices like regular exercise, maintaining a healthy diet, engaging in hobbies, and fostering social connections can greatly contribute to mental well-being. Thank you, Your Excellency.
Thank you, Dr. Ramjan. I really appreciate that. And I appreciate that, Jim, especially the welcome that is necessary to add to the conversation about making sure that we have access. Here in the United States, we have a new system, which I'm so happy. One of the things that mental health brings to the United States is outward pouring of support. So those that are in high power positions here in the United States that are dealing with certain issues tend to get the bills passed, the legislation passed, and they put their money where their mouth is. I can say that. Sometimes it's for hidden agendas and for personal gain. But in this case, there was a senator's child that was that had mental illness here in the United States. And they were out and about doing their, I guess, daily fun time. And they went into a psychotic break. And no one was able to get in touch with the 911 receptors here in the United States. And they said because I guess it was jam-packed, I guess, one of the days that you ever call 911 and it says, please hold or something to that effect, because so many people are calling in. And it normally happens when it's a catastrophe, like if it's a car accident and 50 people are calling in at the same time, they'll put you on hold. But this so happened to be a day where everyone was in the park. The child went through a psychotic break and she didn't get assistance. Apparently something was a breakdown in 911 getting mental health assistance to the rescue, and she ended up passing away. We don't know to this day, they didn't release whether she had a seizure, whether the mental break was truly catastrophic, or if it was like an aneurysm of the brain, but she died on site. And thus from that was legislation that passed, and it is now the 988 call, the number that you can call. Just like 911, 988 is the number that you call for mental health. And it's the direct line to emergency for mental health. So little things like that help here in the United States. But what about those things that, or those areas or situations that have people that are in rural areas that don't have the access or the infrastructure, the bandwidth even, to have a 988 system? These are things that we are looking at today. And I think what we're going to see is a few of our panelists are going to start talking about what it is that they are going to bring to the table. Of course, the questions that we said we were going to have, and then solutions that should be ready for you. Our panelist today is Diplomatic Ambassador Sarah Dansoho. We have Madam Ambassador Aisha Bello, Madam Ambassador Ruqaiya Ibrahim, and of course, our Grand Marshal for the day is Mission Ambassador Hamza Hussein. And these are the people that we're going to be seeing today with as our panelists. We're also going to be taking a great stroll down the Middle Eastern walk, and we're going to have closing gems from Ambassador Wissam Dodar from Lebanon, who also represents Syria, Afghanistan, and the United Nations. So I want to thank each and every one of you for coming today. And without further ado, our first speaker today will be Ambassador Sarah Dansoho, who is Diplomatic Ambassador for FIRE. She's a women in peace building, sexual and gender-based violence advocate, educator, and just an all-around great woman. And I just want to welcome her today. Thank you so very much, Ambassador, for coming. I want you to answer, say a little bit about yourself and answer this question if you can. How can Nigeria merge culture, language, and tradition into full access to mental health in undeveloped areas? Please.
Okay. Good afternoon, everyone. Can you hear me?
I can hear you well, and I can see you well as well.
Hello, can you hear me?
Yes, ma'am.
Okay. Thank you so much. I'm happy to be here today, and I welcome Karen Lotolumas. I'm sure she's fine already, and my colleagues and fellow ambassadors. My name is Sarah Tama. I am in Nigeria. I'm working in security sector, gender-based violence, electoral reform system, and promoting good governance, actually. So in based on the question that you have asked, how can we manage culture, language, and tradition into full access to mental health? As we all know, cultural diversity is not is divided into so many contexts. So in Nigeria, we have so many languages, so it cut across, and every culture has its do's and don'ts. So the issue of mental health is not something that it is something that will stay with us whether we like it or not. But what we are doing as an advocate, we try to see how we can mitigate and make it minimal in the society. And another factor again that is causing the issue of mental health issues to be on the high side is due to so many factors. It could be environmental factors, it could be economic factors, it could be corruptions and all. It is really an issue in our society. But what we encourage is to engage our citizens, community through awareness campaign on how to avoid some of this, not to get to that critical level where it becomes an issue. And then just a few days ago, the Federal Ministry of Health just had a workshop on mental health bill. Implementation of that bill is what we are trying to see that it come to pass. So that is some of the interventions that we are working on to see that the bill is passed, because when we have it at the policy level, it can be implemented, and then it will go down to the community level as well. But we hope to see that we have a mental health free society, or at least to a minimal level. Thank you.
Thank you, Ambassador. I really appreciate that. Succinct and very to the point. And I like the fact that the bill is being issued in. We're going to say quite a few prayers for that, because we know that it's very necessary for us to be able to support something as important as this here in the United States. We're going to get the word out for those that are from Nigeria to be able to get the momentum going. I know we can't necessarily vote when we're here in the United States, but I think getting the momentum out for those that are kind of on the fence is something that we need to do. And definitely, I can't see why it wouldn't be supported, because again, it helps those that can't help themselves right now. So thank you, Ambassador. I really appreciate your time. And I definitely appreciate that insight. Ambassador Dansoho is going to be leaving us. That's why she was put up first, because she has a meeting in a few minutes. So thank you, Ambassador, and I really appreciate your time with us today. And if you have to leave, you can leave if you don't have any other questions, or if you have any gems that you want to offer. So when your time is up, we thank you so very much for being here today. Next is Ambassador Aisha.
Thank you so much. I'm happy to be here.
Yes, thank you. Thank you again. Madam Bello is the founder of the Voice of the Girl Child and Vulnerable People Foundation and the Guard Up app. That's my app. I know I'm in the US, but that's my app. She is also Deputy Mission Ambassador to Nigeria. The Guard Up app is something that everyone should take advantage of, take a look at. Ambassador Bello would be able to give you more information on that, as well as the link if you are an Android user. I'm not too sure if it's up on iOS yet, because if it was, it would be on my phone. But I want you to get involved with her ASAP and allow her to understand that you are all in support of the Guard Up app. Madam Ambassador, if you would, could you unmute your mic and answer this question, please? In Nigeria, what will it look like to have full access to mental health services, either virtually or in person, for women in rural areas? Please outline what a thematic plan might look like.
All right, good afternoon, everyone. Thank you so much, Dr. Amina Ali, for inviting me to this program, because mental health issues, I think, is a very, very serious challenge. Having come in contact with people with mental health issues, like, it's man, sometimes I used to wonder, like, I don't even want to go close again because it's so overwhelming to the extent that you would think of a lot of things and start thinking, oh God, why am I still alive and all that. So anyways, I think it's high time we discuss about it a lot. And I'm glad this question is talking about the rural areas, because we know that in the cities, people are gradually getting to know about this mental health issues and what they need to do. But when you talk about the rural area, it's something that we have to do a lot. So we talked about, you asked about the thematic areas. And for me, I would say the number one area we need to look at is education and awareness. Um, and this education and awareness involve like having discussions, just like what we're doing right now, on mental health issues and the importance of seeking help. For example, now, yesterday, somebody called me and she was talking about her daughter, the challenges they are facing. The girl is, acting funny. And it's something that has to do with the symptoms is in line with depression and all. So she told the daughter, okay, let's go to psychiatric hospital. And the daughter said, no, me, I'm not mad. I can't go to psychiatric hospital and all that. So these are some of the challenges we have. So when you talk about the rural communities, they have that belief. So when you say go to psychiatric hospital to seek for help, they feel that it's only for mad people. And when they go there, it is assumed that they are mad. So we need to create more awareness. So education and awareness is very key. So the awareness can be done through maybe public campaigns, workshops, seminars, and even little community gatherings, because most of these rural communities, they have their association, the Market Women Association, the church members, they have their, what they call the women group or something like that and all. So these are areas where we need to look at to create more awareness for them to know more about mental health issues and how to seek for help. Then the second thematic area is access to services. And this involves providing access to mental health services in rural communities. And this can be done through establishment of mental health clinics in the rural community, because we need to have those areas. And if possible, we should train some of the health workers there, and also telehealth services. And this is something that the Guard of App is already looking at. We want to provide mental health through the app, through the use of the app, whereby we'll have links to psychologists and all. You can easily dial their numbers and talk to them. So, because I understand that sometimes issues of mental health start with just getting somebody to listen to you, just talk to somebody, and sometimes you feel better. So, this is something that we on our own part too, the Guide Up app is looking. So, providing services to rural communities is very, very important. Then, number three thematic area I'm looking at is support services. And this involves providing support services to women in rural communities. And it includes what counseling, counseling services, support groups, and other forms of social support. And just like I was giving an example, the church members association, if we can bring women together to form these support groups, that will help to create awareness. They usually have their meetings. They should be able to talk about issues that affect them, what they need to do, and also the link to psychologists when it's beyond their own powers, so they can always refer to psychologists. And that's where we also want to bring in the Guide Up app too as well, so that they can also link to psychologists without coming out of that community, traveling far to meet a psychologist or something. They can easily just dial the number and talk to somebody. Then the number four thematic area I'm also looking at is research and evaluation. And this involves conducting research to better understand the mental health needs of women in rural areas. Because whatever project we need to do, you need to conduct research, you need to understand. Now, people living in rural communities are different, their situation, their environment are different from those in the city. So you need to carry out research to better understand the mental health needs of the rural women, and also evaluate the effectiveness of the services provided. You need to go to the community, look at what they have. Do they even have any mental health clinic? Is there any psychologist and all? So you need to do all those things. So we need to look at research and evaluation too as a very, very important thematic area. And then lastly, we also need to do a lot of advocacies, advocating for better access to mental health services for women in rural areas. And this could involve lobbying for increased funding for mental health services and advocating for policy changes to improve access to mental health services. So these are the 5 thematic areas I have considered that is very important when we are dealing with rural mental health and women in rural areas. Thank you so much.
Thank you, Madam Ambassador. Thank you so very much. That was Deputy Mission Ambassador Aisha Bello from Nigeria. She was speaking very, very eloquently. Ambassador Bello, you actually have a question in the chat from NYU. And we have a few questions that are popping up in the chat. So if you can, if anyone in the panel or the audience would like to answer any of the questions, please look at the chat. They come up and we have our interns post them for whoever the question is specifically, or if it's a question for anyone. So we have a few questions coming up. Please check the chat as you're waiting for the next speaker. So thank you, Ambassador Bello. I really appreciate it. If you could put the information for the GuardUp app in the chat as well, because I'm pretty sure some of the students are asking for it. Your question is about the GuardUp app, as I mentioned it. And if you can put some information or the link or something in the chat, please. Thank you so very much. Our next speaker is Mission Ambassador Hussein Hamza, leader in gender and human rights, sexual and gender-based violence, and community affairs. He's a mission ambassador for the Federal Republic of Nigeria. Ambassador, if you could unmute your mic, tell us a little bit about you, and please answer this question. What systems are in place for the North and South of Nigeria, respectively, that needs help to expand? And what would it be if we could design a plan to be ready? And this is a question from the students, so I wanted to make sure that it went to you directly as lead for Nigeria. You can start with the North and end with the South, or however, whichever one is the one that's in most need. But you can start now. Thank you, Ambassador.
Okay, thank you very much, Dr. Amina Ali, for this wonderful opportunity to be part of this presentation and also to be part of the panelists. And I believe with this event, it will help a lot of people that are facing challenges towards mental health. And my name is Hussein Hamza. I'm the mission ambassador to the Federal Republic of Nigeria and the Federation of International Gender and Human Rights. And good day, everyone. All protocol duly observed. And as we all know, this Nigerian health system is run by 3 tiers of government, where the federal government manages tertiary healthcare, and state government manages secondary healthcare, and local government is responsible for primary healthcare. And there is no doubt there is need to improvement of delivering in Nigeria in a situation where many Nigerians, including government functionaries and their families, travel abroad for medical checkup and treatment leaves much to be desired. And we have some recommendations that I made towards how we can, solve this problem that is occurring in our country. And number one, I said they should strengthen existing health facilities and programs. And also, it is also important to provide a better enabling environment for health system practitioners to give their best, optimize their potential, and deliver optimal health services. And also the second one, I said there's supposed to be a provision of physical development infrastructure, because over the years now we have been witnessing a lot of medical tourism out of the country for alignment that would have been treated even in the primary healthcare center. But we see people leaving the primary, secondary, and tertiary healthcare centers in the country to other countries. And therefore, we have to the needed infrastructure, because a lot of people do not need to travel before they can have access to healthcare. And also the third one said, I said the government should also reduce taxes on medical consumables and all other things that are related to the health industry, because government at all levels should first look into enhancing the capacity of health workers through constant training and retraining. For instance, in medicine, we have new cases that have been resolved every day. And I also mentioned that there's supposed to be an introducing medical information system in a way to monitor public health threats through medical report, and it can combat and monitor the outbreak of communicable disease because this system will help to improve the healthcare system in Nigeria, both the south and the northern part of Nigeria. And also there should be health campaigns, because this most potential way to improve the Nigerian healthcare system is by organizing health campaigns and spreading awareness about disease and their cures and prevention. Because when citizens are aware of this disease, they'll be able to prevent and cure, then only a country that be safe from the disease. And also we need to set a goals, because we need to set a goals and also committing evaluation, because analyzing patient data and setting goals is another innovative way of improving health structure of a country. And we need to prioritize the areas and set up goals. Then committing to ongoing evaluation is a must. And therefore, for a better happy life, one needs to maintain a positive health. And one of the best way method is to do things that you are passionate about doing in your life. Thank you very much.
Thank you. I'm sorry, I'm so sorry. Thank you, Ambassador. I didn't get off mute. I want to thank, first of all, Ambassador Hamza, because the understanding of what he said and what he spoke about branches over to a greater understanding as to what it is that we need to do. He spoke about community and the effects of community. And I guess my question to everyone, and maybe outside of the questions that are in the chat, what are we doing to affect change in our community? And that's a question that probably strikes at a nerve of everyone, because sometimes we don't have an answer, and that's an answer. And then sometimes the answer that we have is deficient because we haven't shown so much cause. Now, I don't want to be overwhelming by saying that we have to be a part of it, but if you're here on this this event today, if you're here listening virtually, if you're here understanding that you are a part of the solution, truly you have been called for a time such as this to hear the information and then begin to disseminate it through resources, through support and advocacy, and definitely through solutions. So I'm going to ask that while you're listening to the solutions, while you're writing things down, because I have a whole list in front of me, I want you to understand that part of your responsibility today is going to be to start helping in this community. Now, May is going to end in a few weeks. We got about 2 weeks left of the whole month, but mental health is going to be a continuum. And we have to understand that this is not going to go away. It's not going to stop because May ended. It's not going to stop because we have this town hall. We're going to have people in our family, in our community, in our area that is going to need mental health issues and mental health, will have mental health issues and need mental health solutions in your area. So I am just going to applaud those that stepped up to be here today. I'm going to recognize a few right now before we go on to our next speaker. Of course, we have Madam Ambassador Alana Kling from Trinidad and Tobago. She is diplomatic ambassador there. And she deals with domestic violence, intimate partner violence, and those that are dealing with sexual and gender-based violence. So thank you so very much for coming. Of course, we have our own in-house chaplain, Dr. Karen Lomax, who is our advisory council lead she's in our C-suite. And she is here. She is also someone that is really, really big with focusing on your spiritual connection to the trauma and trials that you're in. So thank you so very much. We have, let me see, let me go through the list. We have Dr. Timothy Sharon from Trinidad and Tobago as well. He is a board certified clinical psychologist. Madam Victoria, Gila Singh is also here. She is also a board certified clinical psychologist, and she is looking to advance her training in areas of Trinidad and Tobago, and of course the US, in the talks that she does. We also have Madam, Her Excellency Tracy Onassis Haynes, and I want to thank you so very much for coming and joining us today. We have we have Timothy, we have, not Timothy, I said Timothy already, I'm sorry. We have Ambassador Adegun Tamateo. He is here from Wheels of Hope Foundation. He is coming to us to represent Nigeria as well, and his cause is definitely something that we support deeply at the Federation, and we want to thank you for coming aboard. Thank you so very much for being here and being a part of these history-making solutions. Our next ambassador is Ambassador Ruqayya Ibrahim. She is our final ambassador and panelist for today. She is diplomatic ambassador for the Islamic Republic of Nigeria, Islamic Republic of Nigeria, sorry, but it's Federal Republic, I apologize. Project manager of Education Can't Wait, and former education manager of Street Child of Nigeria. That really impressed me. She's going to be speaking today. Madam Ambassador, if you can unmute your mic and please answer this question. In the event of a natural disaster, a war, or tragic event, such as an earthquake, what is in place now in Nigeria to meet the needs of those that are currently under medical care for mental health? What needs to be implemented for better crisis management? This is going to speak directly to getting solutions in real time for those that are dealing in crisis. So, Madam Ambassador, could you unmute your mic? The floor is yours.
Thank you very much, Dr. Amina Ali. And Assalamu alaikum, greetings of peace to everyone. So I will be talking about what it takes to meet the needs of those under care in case of natural disaster, a war, or any emergency. So for mental health, there are different levels and categories of those under care and the different care that they need. There are about 4 tiers of needs and care on the mental health pyramid. We have those at the foundation level, which can, and the care for them can be done by anyone. A child, somebody feeling sad, you say, well, girl, words of encouragement, you take the person out of his misery. You go to the second tier, and these are people that require psychological first aid. This can also be done by anyone. A woman lost a child, a husband, or anyone, you comfort that person and help the person to douse his trauma or her trauma. That is the type of care the person needs for his or her mental health issue. Then we have those on tier 2 and tier 1 who need from basic counseling to specialized care. So for my discourse, I'll be looking at those on tier 2 and tier 1. That means those that need counseling and specialized care in terms of emergencies, war, outbreaks, what happens to them? What are we doing in Nigeria to support them? So when disasters strike, such as armed disasters, community clashes, insurgencies, banditry, or militant attack, or when natural disasters occur, like in Nigeria, we're so prone to flooding, most especially in the present rainy season. What happens? So before the last 10 years, there has been no crisis management plan to respond to emergencies for those receiving mental care. But with the recent awareness around the world for mental health and subsequent disasters that have occurred, plans are emerging in Nigeria to care for patients and persons under care. Some of it is that the government, Nigerian government, has signed a memorandum of understanding with some non-governmental organizations and international organizations such as the IOM that are supporting the government in terms of mental care, right from the implementation of the healthcare delivery and then during emergencies. There is also a mental health and psychosocial support sub-working group presently in Nigeria that is chaired by the government's neuropsychiatric hospital and then the International Organization for Migration, with partners all over that have a mandate in delivering mental health care. This is to give holistic care both without or with the emergency happening. So this care is for those both in the communities that require mental support and also patients that are in controlled environment in hospitals. On the side of the non-governmental organizations implementing projects on mental health care and psychosocial support, majority implement using a preventive approach in the first place. This is through engaging, training, and building the capacity of community volunteers. You see, if disaster strikes like flooding, it reduces road access to communities, to deep sites, to the rural communities. So one of the ways to counter this that is on ground now is the training of community volunteers to not only identify cases, but also to refer and to continue with the care in cases of emergencies. The government and NGOs also work collaboratively. This helps both in sustainability and during crisis. NGOs collaborate with the national emergency management agencies and those in the states in Nigeria who are specialized in disaster response and prevention to prevent MHPS, to implement MHPSS projects for sustainability. So while emergency management agencies respond by providing services such as evacuations, providing goods such as foods, providing non-food items for those survivors, the NGOs now come in with the psychological first aid. This helps to now calm the survivors down, and then later on checks are carried out to see whether they need specialized care or not. So NGOs also do a follow-up visit after disasters and emergencies to check for relapse, then support with livelihood, and also refer to government community development projects and other ministries to cater for mental health survivors. This is actively happening in Nigeria. But then it's in very few places. It's not widespread. And this is one of the ways that we need to upscale and build it more in every community such that that access is created. And when disaster strikes, care continues. It doesn't stop because disaster happens. So part of my question is to talk about the needs to be implemented for better crisis. One thing I know is mental health care is the responsibility of everyone. Everyone is an actor. Everyone can do something. So for the NGOs and the government, first of all, there is need to build capacity of social service workers from the ministry level. And then from that ministry level, either at federal or state level, the trained personnel go to the rural communities to cascade the trainings to their own personnel, because most of this training are concentrated in the urban areas. Now, all parents, most especially in rural areas, teachers of children, including both formal schools, non-formal schools, religious teachers, traditional teachers, they need to be trained in issues like positive parenting, social emotional learning, psychosocial support to cater for traumatized children, to change parenting narrative, change ideas of corporal punishment to discipline, to maintain a child's mental stability, self-control, emotional intelligence, independence that will help to build a successful and responsible individual. And also the WHO earlier has trained personnel on mental health gaps all over Nigeria. But then after this personnel were deployed to rural communities and, after a while they pulled back to their where they were earlier, and it's not working. If we can have this personnel retrained either by government or the non-governmental sector to go back, be supported to go back to the rural communities, they will support better during disaster, most especially as our rural areas are very, very prone to disasters. Then all actors need to look at a larger population sensitization. I want to see a situation where we can bring in behavioral changes that even disaster and environmental preservation. Through preserving our environment, we tend to prevent disasters from occurring in the first place, not even about mental health now. So with that prevention, we are also preventing disasters that will affect patients or survivors receiving mental health care delivery. So I think I have said my point, but in conclusion, I want to reiterate that mental health is everybody's business. We are undergoing stresses, distresses, loneliness, and some even medical certified issues. So what are we doing as individuals and as groups? As my lead said, what are we doing to effect change in our communities? Thank you very much.
Thank you, madam. Thank you so very much. And I want to thank you for so in-depth of a coverage for this. And turning it back, accountability is definitely personal. And I've always believed that accountability needs to come from those that can atone for what has not happened and can infect change for that which needs to happen. So thank you so very much for confirming that today in what you said. We have a few questions that are here. Our live stream questions are coming from, actually it's not Columbia today, it's NYU and just Fordham. And the questions are in the chat. If you have not checked out the chat, please, please, please check out the chat. It is definitely a need and a necessary agent. If you have answers to any of these questions, even if you're not in Nigeria, if you have an answer that can help to start the process, you never know what you're going to trigger. Sometimes I'm in meetings about climate control or climate change, and I get something about gender and human rights. So it's never something that you can't help or you can't do just because you're not in that room or you're in a different room. So please, please, please look at the chat. See some of the questions that are coming through, especially the one that caught my eye about postpartum depression, because you know that that's where I am and that's what I hold very, very near and dear women, and especially vulnerable women in rural areas that are birthing. So this is definitely a topic that I want to get into. I'm just going to read some of the questions that have been given thus far on the chat, just so if you want to, you can put it in there. I'll read the question and then I will speak to what it is what school it was. For example, there's a question from NYU on accessibility. Are there any awareness programs in Nigeria that sponsor mobile camps of students that will train in mental health? And the mobile camps here in the United States is just that, where a group of kids get together and they do like a summer program where they come together and they'll talk about maybe childhood suicide. And these mobile camps are just that. They move from area to area. So you may be talking about childhood suicide in the state of Washington. And then they'll get together in maybe Oregon and they'll deal with teen suicide. So these mobile camps are different ideas of practitioners that get together in different areas and talk about the mental health disparities in that area and then bring solutions. Of course, those that are closer to the problem is always closer to the solution. So the question is, in Nigeria, are there any accessible mobile camps for those that may not be able to access care, maybe going through a therapist, but if you get involved in one of those mobile camps, you'll have therapists that are together for the cause of whatever they're there to get, and they get service there. So is that an option? Is that an opportunity to have a mobile camp, C-A-M-P? All right, there is a question from Fordham. What is being done about the relatability of mental health? This is to include language, culture, and pay disparities for those practitioners that want to get involved but don't have access. So for example, the question is, what's the relatability of language, culture, and pay in Nigeria? Here in the United States, and I can only speak, if there is a need for a practitioner, we will bring that practitioner to the area, pay them a nominal fee, and make sure that they speak the language and they understand the culture. So there is a cultural appropriation that is given to that leader. Are there any of those that are relatable in North or South Nigeria? Now, again, this is to include far west to Kebbi, and maybe even as far east to Cross River and Benue. But I want to make sure that Nigeria is covered in making sure that there is relatability, which is language, culture, and pay. What are some of the programs that relate to relatability? And you could give that in the chat as well. And if anyone wants to answer this from NYU on accountability, and I just jotted it down as we were going through. Accountability is how many of the chiefs, the nobility, those that are ministries in the heads of ministry, how many of those are actually putting their money where their mouth is as far as doing the work, not just saying, oh, we're going to have mental health in Edo, or we're going to make sure that Oshun has a virtual opening that's going to be connected to Lagos. No, what are the ministries of health? What are some of the chiefs doing in, let's say, Bauchi and Kaduna up north where there's insurgency? What is some Zamfara, which we never hear about, but of course, as we know, has a great need there in the north. That's more northwest though in Nigeria. But what are they doing there? What are the ministers of health doing there? So these are some of the questions that the students have about Nigeria. If you can go through, the first one was accessibility for the mobile camps. Do you have mobile camps? Second one was relatability, language, culture, and pay. What are you doing in the far reaches of the most rural areas? And then the accountability. What are the ministers, the ministry heads, as well as the chiefs doing about that in the far reaches of north, south, east, and west of Nigeria? So those are the three questions that have come in that I picked up while I was listening. I also wanted to add that to the questions to the chat, but since I mentioned it verbally, we're just going to move on to the next set. Our final question for the day. Now, this is for all of the ambassadors that have remained. We're going to be talking to Ambassador Bello, Ambassador Hamza, and of course, Ambassador Ibrahim. And you're going to answer this question, if you will, very quickly, very succinctly. And this question is going to be directed to you specifically. We'll go to ladies first. So Ambassador Ibrahim, after the crisis has passed, what are some steps that Nigeria is taking to implement aftercare programs in the community to allow ongoing and sustainable care in mental health? In your area, Ambassador Ibrahim, what are some of the programs that are being offered there as far as aftercare?
Okay, thank you very much for the question. For aftercare service, we have referral services that is a result of that collaboration I spoke about earlier. So for those given, for example, psychosocial support to children in temporary learning spaces or temporary safe spaces, these kids, after receiving care, or children that are affected or that have relations with armed groups and armed conflicts, after receiving care, are now referred. They are put back in school with scholastic support. Youth are referred to ministries of youth. And for children such as the unaccompanied, after receiving their treatment, they get reunited with their families. And then there is also a referral either to units, livelihood units, or components of the government that give livelihood support, such as the Ministry of Women Affairs, and also the Ministry of Social Development, that support youths and adults with livelihood opportunities after receiving mental health care. Then there is the post-care support also, which comes in the form of post-unification visits for unaccompanied and separated children and children associated with armed groups. So generally, these are some of the services that come after the crisis. Thank you.
Oh, thank you. That was awesome. Okay, Madam Bello, if you can expound on your area, what are some of the aftercare programs in the community?
Just like Rukaya said, establishing the aftercare programs. And also from my discussion, or from her own discussion, let me just talk about her own, what she said that I held, like, she said the WHO trained some volunteers to have something like the mobile group you just talked about, and it's not working. And you also talk about culture, tradition, and also for me, I think aftercare should do more with the community people. There should be training of the community members themselves on mental health issues and all. Then aside that, Ambassador Sarah talked about the national mental health policy, which Nigerians are already working on. And that policy has a lot in it. It helps to guide the government on how to address mental health issues in the country. And this policy includes the strategies for prevention, early intervention, and treatment of mental health issues. So with this national mental health policy, this will give us a lot of information on how to handle aftercare, because I know that we have not really been working on aftercare strategies. But I believe that with this policy, it will go a long way, and also improve on the awareness programs. Though I can see that a lot is already going on TV and radio stations. We've been hearing issues of mental health. The TV, that's the media, are doing a lot there, inviting professionals to come and talk about mental health and why it is necessary to seek help.
Okay, thank you so much, Ambassador Bella. I really appreciate that. And I appreciate you partnering with Ambassador Ibrahim on the issues. Thank you so much for the mobile camps, because that was an issue. A couple of students, as you know, each year they go over to different countries and they do mission work. Some of them do internships. These are things that they are wanting to do. They started in Trinidad. They're forming a coalition for August. For Trinidad, I know there are 2 students from Fordham that want to go, that are Bangladeshi, that want to go to Pakistan in July. So that's being taken care of right now. They're going to be working with the mental health there in Pakistan. And now we have the mobile camps and the 3 students from Fordham that are doing social work and social psychology majors. They're wanting to come to Nigeria. And I believe one of them is from Sierra Leone. The other one is from Togo. And they want to come to Nigeria, and they're the ones that pose that question. And I know them well because I work with them here in the United States. But they want to go to West Africa and to do the work on the ground. They are students now that are still studying. Of course, they don't graduate till next year, but they have to do their internship. They have to do their fellowship. The fellowship is domestic. Internship can be anywhere. But they want to do something that's going to mean something. They want to leave something to the people rather than just say I was there and, stoke your flag and then just move on. They really want to do something that is going to have a lasting impact, and something they can come back to, after they graduate. Maybe they could do their first year there, or maybe they could set up a mobile camp there, and do that rotation where they start in maybe FCT and then they move southwest to Oyo and Oshun and Ogun, and then move all the way over, go up west to West Niger and Kebbi, and then move over to Kano and Bauchi, and then over to Taraba and back down to Cross River, and do that circle of Nigeria. That would be really nice, because then it would bring repeatable programs to the area that can span out. And that's, again, what our point is, what our determination and our mission is, to do something in one area that someone can repeat in another area. So we're encouraging repetition. We're encouraging those to take our plan. As one of my colleagues said, she said, Dr. Mina, aren't you afraid of, what did she say? Intellectual property being taken? I was like, no, we're encouraging it. We're encouraging the fact that we have a plan, a program, something on paper, something that is tangible, that we have that works in one area. Yes, why wouldn't you repeat it in another area? I mean, that doesn't make sense. Why would you want to hold that and just, copyright it for this area? That doesn't make that, to me, it just doesn't make sense. But yes, we have repeatable solutions. We have sustainable plans. And our mission, of course, is to make sure that this is for you here in Nigeria as well as other areas. All right, last but not least, we have our mission ambassador to Nigeria who will answer this last question. Ambassador, after the crisis has passed, what are some steps that Nigeria is taking to implement aftercare programs in your community? to allow ongoing and sustainable care in mental health. Please explain, and you can unmute your mic.
Thank you very much, Dr. Amina Ali, for the question. I think a lot of initiative has been implementing a lot of programs towards helping and also towards supporting the victims of of mental health. And I know there is one initiative in my community in 2010 that launched a program in Nigeria over towards a healing and developing community health system, and in terms of the reducing country's mental mortality rate. And one of the world is providing some of the Nigerians poorest and most rural areas with proper health facilities and the warrants as well for an NGO. And also it has early this morning we also went for outreach based on mental health to for some secondary school students in my society, where we try to create a lot of awareness towards how we can cope these mental health, and also how the young people can prevent for themselves towards this mental health, and also educate them about whenever they experience these mental health, they should try to tell people around them so that they can they can give them a maximum support, and also they can share their problems with whenever they think that they trust. I think with this we try to educate more than 100 students towards these issues, and thank God we had a lot of feedback from them. Thank you.
Yes, thank you. Yes, that is big. That's big, especially in the school system. Yes, and that could be a nice little mobile camp right there. And those mobile camps can converge onto that school and be that mental health for that school, or have mental health therapists come back and forth to different schools and rotate a system. That would be amazing to see that. And then be able to implement that under the new mental health program that is truly, truly in effect there in Nigeria. And I thank you all for working so hard on that. And for the record, I'm more impressed. I thought it was going to just die by the wayside when it first was introduced, but I'm so glad that each of you are able to move the needle just a little bit more on that legislature to get that bill passed, because that's very, very important. And I tell you, you got support over here. Thank you so very much. I want to make sure that everybody understands that there is a need in the community, both in Nigeria and other parts of the world. And of course, as we go to the next level of care, I don't know what happened. The next level of care, there is going to be a great situation that is going to be incumbent upon us. There is going to be a need for everyone to get together and use your talents, gifts, and abilities to be able to sustain this progress. We talked about this in Trinidad, we talked about this in Pakistan, and now it's Nigeria's time to talk about solutions. These need to be tangible solutions that are reported in your community, that can be relayed back to your government. We don't need the government to get involved in our business if we're doing it ourselves. What we need is support from our local community, our community leaders, and those that are in the business of supporting us in the work that we do. We also can pair with other world helpers, such as Nigeria and Trinidad getting together and doing a policy change. We can even have Lebanon, who we'll be speaking to in a minute. Lebanon can partner with the UN, of course, and offer what the UN is doing. Then we can have Zambia and our mission ambassador to the African Union come aboard and tell what it is that's happening in the African Union, and join forces so that everyone is on the same page, doing the same thing, hoping and helping to relieve the suffering of those dealing with mental illness. I want to thank each and every one of you for coming today. I want to thank especially Dr. Ramjan for coming in and being our speaker. I'm going to give the chance to a mission ambassador to Lebanon, Ambassador Wissam Dodar, to come in and give final thoughts. And then after that, I'm going to ask if Ambassador Lomax can come and give our benediction and prayer, if you will. So Ambassador, not Lomax, sorry. Ambassador Wissam, can you unmute your mic? The floor is yours.
Thank you, Your Excellency, and thanks for all mission ambassadors. I will never mention names, so I'm afraid to miss someone. Sure. Thank you for the valuable speeches and for the valuable information you provided and brought to the table. Just allow me to provide a brief about mental health in Lebanon, Syria, and Afghanistan. Mental health services have been available in different countries, including Lebanon, Syria, and Afghanistan, long years ago. But with the agitation of the area and having people who are forced for internal displacement or to refuge outside the official boundaries of neighboring countries to neighboring countries, mental health services were coupled to psychosocial services under one domain, namely mental health and psychosocial support. In Lebanon and Syria, these activities under this essential health program component were intensified and shouldered by different NGOs in addition to ministries of public health in affected countries, and psychosocial support as well. I mean the crisis of Syria that started in the year 2010 and the ongoing episodes of internal and external conflicts in Lebanon as from the year 1975 and on. The same was for Afghanistan, and the services are intensified there as from the year 2001, the famous war that affected Afghanistan, as you all know. Also, again, the services are intensified in Syria with the initiation of the earthquake that hit the country early in February 2023. Despite the large number of people affected by problems of mental health and psychosocial well-being, and the ability to successfully prevent and treat these problems, only a small minority of people actually have had the access to this care for a variety of reasons, including lack of knowledge, stigma, lack of access to qualified facilities. In addition, opportunities to prevent mental health deterioration are often missed in primary healthcare settings due to lack of knowledge and skills among healthcare professionals working there. International research agrees that integrating mental health and psychosocial support services into primary healthcare is the most viable way of closing the treatment gap and ensuring that people get the support they have or they need. It is also an effective way to prevent mental health and psychosocial support issues and to protect individuals and families. It has been reported that globally, 1/3 of persons visiting primary healthcare have issues related to their mental health and psychologically well-being. It is also recognized and recommended by the WHO that around 70% of mental health and psychosocial support cases can be carried out and managed at the primary healthcare level. Among the vulnerable groups, 1 in 5 children suffers from mental illnesses, and the mental health of an aging population suffering from non-communicable diseases is influenced by their access to services, education, employment, housing, social services, and discrimination, in addition to neglect. Evidence suggests that women, the most frequent visitors of primary healthcare clinics. Why they are the most frequent visitors of primary healthcare clinics? Because the male individuals, especially men, will be engaged in getting bread or working outside to bring bread for their families. So women and the children are the most frequent visitors for primary healthcare facilities. Evidence suggests that women have higher rates of mental illnesses with an average female to male ratio of 2.3 to 1, and almost the double among adults. Mental health and psychosocial services are support and well-being has a direct effect on physical health and well-being of individuals and their families, and vice versa, because both components of primary healthcare are interlinked, the physical health and the mental health. For example, maternal depression impacts the health of mother and the child, possibly leading to child's poor birth weight, growth restriction, and poor cognitive development. As from the year 2018, great efforts were made to integrate mental health and psychosocial support into primary healthcare services, especially that, as we mentioned, 70% of the cases can be managed at the primary healthcare level. And this was launched by United Nations in the affected areas like Syria and Lebanon. This was shouldered by well-trained medical professionals and clinical psychologists as well. Evidence also shows that comorbidity or the existence of psychological problems and or mental illnesses on one side and physical disability or illness on the other side is common in primary healthcare settings. For example, it is well documented that major depressive disorder is a risk factor for diabetes and heart diseases. Non-communicable diseases are also risk factors for depressive and anxiety disorders. Furthermore, clients with comorbidities like depression or depressive disorder with physical disabilities such as NCDs are less likely to adhere to treatment plans for their NCDs. Psychological problems often manifest themselves in physical illness due to lack of education and the stigma surrounding mental health issues. The client often doesn't understand how their complaints are related to their stressors at home or work or in the neighborhood and not any real physical illness. The most common physical manifestations of mental health and psychosocial support issues are tiredness, sleep problems, palpitation or heart beating fast, like tachycardia, headache, other itches and pains, upset stomach, and dizziness and loss of interest of daily activities. Infrastructure is needed as a prerequisite to start the provision of mental health and psychosocial support. It is not like this, we say we have to integrate mental health, okay, let's go and integrate it. No, we have to pave the way and to find the foundation and the infrastructure needed for this very important component of primary health care. For example, and essentially, we have to provide intensified training of existing healthcare givers working at primary healthcare facilities. Also, we have to introduce well-trained and skillful psychologists who will manage the cases. Also to contract or hire with a number of psychiatrists to treat special cases and prescribe psychomental related medicines that are forbidden to be taken over the counter by any patient, unless by a prescription. Also having some specialized hospitals or health facilities for certain complicated mental health cases that need admissions and follow-up. In addition, and in parallel to this, we have to care for the community by raising the awareness of community against the stigma and to pave the way for making the use of this real and essential health domain, especially at such communities, we can have poverty, we can have unemployability, different kinds of life stressors and morbidities that are interlinked together. So we have to provide all essential prerequisites to integrate the mental health services into the primary health care. And it is essential to keep in mind, like 70% of mental health cases can be managed by well-trained healthcare professionals at the primary healthcare level with follow-up and continuous planning of visits and repeated visits in order to follow up the cases. I heard about a question during this session of today. Some of the speakers mentioned or asked a question about mental health services provided via mobile medical units. In Lebanon and Syria, this was not reported. The only primary healthcare services, essential primary healthcare services, excluding mental health, were provided, yes, by mobile medical units. But the outreach is made by home visits of social workers and psychologists to certain cases at home or at certain communities just to discuss, to follow up cases and something like that, especially cases of rape, who will have or need the follow-up after they are discharged from the clinic. They need a certain follow-up and a close follow-up to avoid any attempts to commit suicide or to be stigmatized by the community or something like that. Only outside activities are made, outreach activities are made by social workers and clinical psychologists for certain cases, but not outreach through mobile medical units in Lebanon and Syria so far. Thank you and over.
Thank you, Ambassador. I like that. I like the fact. Well, one of the parts I don't like that it wasn't reported, but I do like the fact that there's implementation in part already there. I like the fact that there are mobile units that are either coming or will be coming to the area, because that is essential. Sometimes it's not about them getting to the services. Sometimes the services can come to them, and the mobile units, just like the mobile groups that I spoke about, or the pop-up sites that we talk about. These are people that go to the sites. So that's very, very important, especially when we're talking about wraparound care, to have people that are able to go where it is needed and necessary for the care that they need. I am going to thank each and every one of you for coming. My 3-year-old granddaughter is here and she is wanting some yaya time, so I'm going to give it to her. But in the interim of knowing that I have to switch hats so quickly and so often, I am going to thank each and every one of you for being here, staying the game, staying the time, and being the asset that we needed to build reputable and repeatable solutions. Thank you so very much from the Federation of International Gender and Human Rights, those allies and supporters, those supporters that came here today. I see you, I thank you, and I appreciate what it is that you do in community. Thank you so very much for all that you are doing and all the many ways that you are coming full circle to help in mental health. Dr. Lomax, if you can, close us out of here, and we will have this sent to the Nigerian delegation probably later today for those that missed the replay.
Yes, we want to thank the Nigerian delegation for that wonderful presentation. And for all of those who joined us on today, these types of talks are important because we want people to know that even though we look at statistics and data, that we don't treat them as a statistic or a number. And someone put a question in the comments, and I don't know if it got answered. I think it may have, but if someone comes to you and they're going through something, they're going through depression, they're having a meltdown, you have involuntarily become an advocate for that person in that moment. So this is why this is important, is to create a network, a safe space, a safe network. And this works. And it works because 2 years ago, I had someone reach out to me on LinkedIn that was in South Africa that was having a mental health crisis. And I was able to reach out to a connection that I had made in South Africa, who was part of, they had a psychological background. So I was able to reach out, get them connected, and get them help. And so that is what this is about. It's about creating a network and safe spaces. And if someone does come to you and it falls outside of your scope, don't be afraid to refer them to a mental health physician. That means knowing who the mental health resources are in your community. All right, so that you know how to refer, who to refer. And if you don't know, there's always your emergency room contacts, doctors and things of that nature. But I just wanted to throw that in there because this does fall really, really close to what I do. And so with that being said, our hearts and minds are clear right now. God, we thank you for everything that has been said today. We pray that someone was encouraged. We pray that someone got the information that they needed. And Father, we ask you to continue to bless everyone in this sector when it comes to mental health. And we ask you right now to touch those who may have confusion in their minds, but be with everyone as we leave this space, but we never leave your presence on today. We ask you to be with us. We ask you to bless us. And we ask you to afford us the opportunity to have more in-depth conversations such as these. And until we all meet again the next time, we'll be forever grateful to give you and only you all praise, honor, and glory for it. And it's in Christ's name I pray. Amen.
Amen, amen, Allah, amen. Thank you, thank you, thank you, thank you, thank you, Dr. Lomax. I really appreciate it. Thank you all, my distinguished guests, our panelists, our diplomatic speaker, as well as the mission ambassador to Lebanon, Syria, and Afghanistan, who has come on and spoken so eloquently. Thank you all that shared this time, to NYU and to Fordham University. God bless you for always supporting us, supporting these events, and coming on the live stream and being a part of us. I really do appreciate it. Just know that your live stream is going to be different than the Zoom. So please look for the replay of the live stream at your, I guess your concierge has it, the one that set up your link, your live stream for today. Those of you that are on Zoom, the Zoom will be available this evening once we finish with the editing, and we will send it out to all the panelists as well as those that requested through WhatsApp. So thank you again. Thank you so very much for having us, and thank you for being here. On behalf of everyone at the Federation of International Gender and Human Rights, all of those that shared this time, all of those that came here, I thank you. And God bless you all. Be well.